We excited, we excited, we excited. Yeah, yeah. Just wait just a little bit of time and then we're going to get on into it. Please share this video if you can. Please share it. We're going to have ourselves a good time. Yeah, that's what we're going to do. All right, let's have ourselves a good time today. Y'all ready? This is how we do this. We want to welcome you guys to the Man to Man Let's Talk Facebook Live show. I'm your host, Eugene Johnson Jr., president of Man to Man Let's Talk. Go to m2mletstalk.com for more information on our organization. This Facebook Live show is designed to highlight the people that are in my world, the people who I'm connected to. I call them my neighbor. And I'm so excited that I have an opportunity to meet this young lady, her Dr. Lataisha Irving. Who is doing great things in the community and want to do more great things. And I think it's important for you to meet my neighbor, Dr. Lataisha Irving. But I want to tell you a little bit about Man to Man Let's Talk. Man to Man Let's Talk is a men empowerment organization with focus on creating a safe place for men to talk, understanding the definition of a man, knowing what our responsibility is in the area where God has put us in. That's important for us to know. And we do this by ways of having workshops, conferences via Zoom right now, as well as our Man Talk Saturday breakfasts. So every month, we're doing something to stay engaged with the men, which is very important. It's hard for us as men to be able to fulfill our responsibility if we don't know what our responsibility is. So we encourage you to please share this information because it just might save a man's life. Ladies, it's important for you to share the information to the men that you're connected to because you never know. You never know that man just might be looking for an organization like ours. Listen, as humans, we are all designed to communicate. It's just a choice if we communicate or not. And men, we have a hard time of communicating based off of what we have been taught. So with my organization, Man to Man, Let's Talk, it's all about talking and communicating. So please, by all means, support us in every way that you can through your prayers, through your resources and finances. Go to our website, contact me, follow me on Facebook at Eugene Johnson Jr., also on our YouTube channel, Man to Man, Let's Talk. We also on Instagram at Man to Man, Let's Talk. So follow us and support us as best as you can, because I promise you, when we finish having this discussion, at some point, whether it's now or later, you're going to encounter a male or a man. Yes, there is a difference between a male and a man. See, we are males by birth, but we're men by choice. If you want to know more about that, contact me and I can share it with you. But you're going to come in contact with a male or a man. The question is, has that male or man been connected to an organization like ours where he'll make the best decision in the world when he's in your presence? So that's why Man to Man Let's Talk is important. And to fulfill our position that we've been given by God. And then our goal is to know the only one that we are striving to make proud is God. Because when we make God proud, everybody else can reap the benefits from it. With Man to Man Let's Talk, we are flooding the news stream with Man Talk Saturday breakfasts on Saturday mornings on every fourth Saturday. We're doing our workshops and conferences every 2 months, every 3 months at the most. On Sunday mornings, we have a word from the Lord at 9 a.m. Please tune into that. It will bless your soul. Every Wednesday, we have Hallelujah Hump Day with me and my son, raising him up in the nurture and admonition of the Lord. And on Fridays, we have words of empowerment. And throughout the week, you get some little spiritual nuggets. That's what it's all about. So I encourage you to stay connected with Man to Man Let's Talk. Be a part of the mission, be a part of the movement, because that's what Man to Man Let's Talk is all about. Whether you are a male, a man, or even a female or a woman, which there is a difference, we encourage all to connect because we're all in this together. So please, by all means, follow us, pray for us, support us, and let's do this together. Help us be best men, the best men that God created us to be. Now, we're going to move into our guests. We're going to meet our guest, Dr. Lataisha Irving. I'm real excited to have this discussion with Dr. Irving and all the great things that she's doing. And before we came on, man, we had ourselves a dandy old time. We just laughing and just being human beings, just being open and transparent about life. And that's what life is all about. So as a fitness trainer, it's important to explore different things on what can help myself as well as what can help my clients. And Dr. Irving is definitely a resource for myself and for my clients. So I'm looking forward to hearing all the great things and services that she has to offer. And we're going to get this party started. So, ladies and gentlemen, without any further ado, we're going to bring in our guest, Dr. Lataisha Irving. Hey, hey, hey.
Hello, everybody. All right.
How are you?
Doing wonderful.
Fantastic. Thank you so much for accepting the invitation and joining us tonight. I'm looking forward to a fantastic discussion. You doing all right today?
Yes, I'm doing wonderful.
Fantastic, fantastic. Well, I tell you what, how about you tell the world a little bit about Dr. Irving?
Well, all right, everybody. Well, I am Dr. Latasha Irving. I am a board certified family physician. Um, I decided to open my own clinic called Exceptional Care Elite in 2020. And my desire was to create an experience that was the complete opposite of what people normally expect at a doctor's office, where you can have less of a wait, really little to no wait at all, and have that real personal one-on-one time with your doctor instead of feeling like that you're on a conveyor belt, just going down the line. And also in doing so, I decided that I wanted to help people to live their best life, their fullest life. So that's something that's very important to me. And I want to help people to avoid over medication by helping them to understand the root cause of problems and not just addressing everything with band-aids. So in general, I feel that in medicine, people address people with band-aids. They put a band-aid over a big gushing, gaping wound, and it's not fixing the problem. It's not solving the problem. It's just giving temporary relief, and then it comes right back. But instead, I decided to create something that will allow people to actually address the root cause of problems, which in general, a lot of times can be hormonal imbalance. And that is helping my patients to actually avoid having to be on multiple medications, coming off of medications, reversing diabetes, helping people with weight loss, helping people with hypertension, preventing dementia, preventing heart disease, preventing strokes, helping with energy levels. So this is what I do.
Fantastic. Thank you. Thank you so much for sharing that. And we'll talk a little bit more about the hormone balance. Real excited about that. But I want to know where are you from and what was the drive to go into the medical profession?
Well, I'm born and raised right here in Houston, Texas. So, I grew up on the northeast side of town. I'm a product of the original North Forest ISD school district. I'm very proud of that. Graduate of Embry Smiley High School. And throughout school, I was always, I think people would probably describe me as a high achiever in school. But I first remember saying that I wanted to become a doctor in the fifth grade. Um, I just knew that I wanted to help people. I wanted to make a difference. And of course, back then, we all wanted to be pediatricians because that's the only doctor that we knew. But as I went on, I ended up in family medicine and just really grew to love that. So from MB Smiley High School, I left there on full scholarship. I went to Duke University, and that's where I got my bachelor's degree. Also, where I joined Alpha Kappa Alpha Sorority Incorporated. From there, I went to University of Texas Medical Branch to get my medical degree down in Galveston, Texas. And then from there, I finished residency at LSU in Shreveport, also in Vivian, Louisiana, in the rural family medicine program. Which is a special program designed to help doctors be well rounded and be able to see patients from all different aspects of life and from area and to be able to work in areas where they are underserved or do not have access to the most technology sometimes. So just being able to go back to basics and listen to people, actually address people's concerns by listening to them and examining them versus always trying to order a bunch of tests and a bunch of imaging on people. So that's my background. And I just really knew that I wanted to make an impact in the Houston community. I used to work at a small clinic here, right here in Houston, off of Homestead, if anybody knows about Homestead Road. And when I was working there was so many people who accessed care there because they didn't have access to care anywhere else. They weren't able to, some of them were no longer driving, especially elders. Some of them didn't have transportation. There were so many different barriers to care. And I knew that I wanted to be on the front line of helping people who needed it. And so that's part of the reason why I came back to my own town, came back to Houston and trying to make a difference here.
Thank you for sharing that. You touched something that I don't think a lot of people are aware of, the discrepancy between uh, getting the right treatment, the health care, and those things. So, do you, with your experience, do you see them like in certain communities
Good.
that they're not getting the proper treatment that is needed, or like it takes a while for people to get to doctors clinics and things like that, and that's why you kind of like in the area where you are. So you could talk a little bit about that, because I don't, people, a lot of people that I talk to, they don't understand, that there is a discrepancy between how healthcare is taking place and stuff like that. Could you share a little bit on that?
Well, definitely, health disparities do exist, especially for certain communities. Disproportionately, people are not able to access health care for a number of reasons. Also, you have to deal with the background of why people also may not like to go to doctors or may not trust doctors because of some of the historical things that have happened. Also, I feel that in some communities, people are kind of trained that way to not access care until the very last minute. So I found a lot of times that in underserved communities, Black communities, Hispanic communities, people tend to get care later. They tend to access care later for a number of reasons, whether that's lack of insurance, lack of health insurance, or lack of funding to go to the doctor. So a lot of times people really struggle with that, and they have a hard time feeling like a burden to the system. Or you will find that people will access care through the emergency room so that they can be seen and not be turned away when they need something. But a lot of times the follow-up care that they need, they're never getting it. The ER will tell them, okay, we need you to follow up with a primary care doctor and to continue finding out what's wrong, and they will kind of just stop right there, once the immediate problem is done. And then in general, things just continue to fester. And I feel that a lot of times what happens is people, because they don't do preventative things. A lot of people have, in certain communities, prevention is not pushed. I feel that people are more reactive instead of proactive, and that's something that I'm trying to create a solution to. So I want people to not feel that they need to wait until everything is breaking down and falling apart. Actually, at my clinic, that's the exact opposite of the way that I address problems. I try to get ahead of the problem rather than waiting until the problem becomes full fruition. I try to not allow that to happen. So that's very important. I think a lot of people, especially in our community, do not access healthcare, and that's another thing that I've decided to do as well, to make healthcare more accessible, is that I decided to create a direct primary care program where the care is directly between me and the patient. There's no middleman. So I have a primary care program that is $75 a month. That includes people's primary care, physicals, access to discounted lab rates. So instead of them going and having to pay a $900 bill, they have much better rates on labs, discounted rates on x-rays and on um, imaging or whatever that they may need. I have patients who have insurance whose insurance won't pay for an MRI that they've been needing for years. And being able to get those patients those MRIs for prices that they never would be able to access even with their insurance. So it's been really interesting seeing how this has changed the dynamic for people being able to access care when they otherwise wouldn't have been able to access care. So that's one of the things that I'm really striving to do. Also, I offer hormone balancing, hormone pellet therapy through BioT. And one of the main things about it is that there are other communities that have been knowing about BioT or been knowing about hormone therapy or the importance of hormone optimization. But I feel that in our communities, people are just hearing about it. Most of the people who I tell about it, it's brand new to them. It's something that they've never heard of, and they're pretty intrigued by it. But sometimes they have a lot of questions. They don't understand exactly what it is or why it's important. So I think that that's been very interesting on my journey.
Woo! Well, you dropping it down, girl. You dropping that knowledge. That's what I'm talking about. Hey, listen, this is really good. And we even have one of my good friends who have a question
Oh,
on this.
yay.
So he his name is Jason. And Jason, his question is on that point, can you please speak to the point about how it is best for patients to be seen or follow with primary care in one single ER? When people have repeat visits, they will see different physicians who may see symptoms differently and treat differently. Primary care has all their records and much better outcomes.
So definitely, I think a lot of times people don't realize what is happening when they go to the ER. So at the ER, you have a physician whose job is to keep you from dying today. That is their job. Their job is, are you dying? If you're not dying, let me make sure that you don't die. And then let me get to you to somebody who can continue to make sure that you don't die. That's what an ER doctor does. Okay. The ER doctor is there to save your life. And a lot of times ER doctors are really feeling burned out because they feel like that a lot of times they're addressing more primary care issues, things that need to be followed, things that need more care, but they're not able to do that because once you leave the ER, they're no longer responsible for you. And I think that that's something that creates a real disparity in care because a lot of people are not able to access a doctor because they feel that it's too expensive or they just haven't found a doctor that they connect with, so they just would rather not, or they don't want to sit there and wait for 2 hours to see the doctor for 5 minutes, that kind of thing. And I feel that that's something that has really affected our community, disproportionately. And we need to understand that there are doctors out there like me who actually enjoy people and who actually want to sit down and spend time with you and have fun. Like a lot of my patients, they say, I've never had this much fun at the doctor's office because we actually have fun. We sit down, we have real conversations because you're a real person, I'm a real person. And I think a lot of times people see doctors in this way, like um I don't know, almost like they cannot connect with us, like we're not real people. And I want to change that dynamic. I want people to know that you can connect with the doctor. You can, we are real people and we do care, and I know that everybody cannot structure their practice the way I have, but I know that the way that I've structured my practice is conducive to developing real relationships with patients and spending time with people. And I think that when you do that and you actually listen to people, people will tell you what's wrong with them. A lot of times, I think the reason why people can never get the right diagnosis or why people are not getting better is because nobody's listening. They're telling you this has been going on. This has been going on for this long. Then this happened. Then that happened. And a lot of times what doctors do, they try to they compartmentalize. So they'll say, "Oh, you have a backache. I'm only going to deal with your back pain today." But then if you listen to the story, they may say, well, the back, it started in my lower belly and then it wrapped around my side and now it's in my back. And if you would listen to that instead of giving somebody some painkillers, you would know that they might have a UTI, a urinary tract infection. But if you don't listen to them and you only compartmentalize back pain, this pain, that pain, and you compartmentalize it all as a separate thing instead of seeing the person as a whole person, then you will miss it. A lot of times people miss it, doctors miss it all the time. And so that's one of the things that I feel that I'm able to do in a better way because I'm able to actually sit down with people, spend time with people, listen to people, and let them tell me what's going on. And then from there, I can interpret what they're saying. But I feel that a lot of people don't understand that the ER doctors are not going to go in depth. If they feel like it's something that's not life threatening, they're going to put a little band-aid and they're going to say, okay, go to your primary care doctor. And they really do mean that, though. They really do want you to go there to get the help that you need so that you can continue to thrive. But it's something that they're not able to do. They're trying to save the man with the heart attack. They're trying to save the man with the stroke, the man with COVID. Um, and if you come in for, you know, a little headache or something, especially, I mean, I know headaches can be serious sometimes, but I'm just saying, something minor or something that you've been dealing with for 3 months and you kind of ignored it and it's really not an emergency, it's just kind of more urgent. They will kind of patch you up and send you out. So
Mm, great question. Great. And Jason, he said, man, you on point. He just said, I sure wish we had a physician like her here in Mesquite, Dallas to refer patients to. I feel bad seeing people struggle with this daily in the ER where he works at in
yes.
in Mesquite. So that's Jason hitting it back. So thank you, Jason, for your comments. If you have any more, please put it in the chat. So could you tell me this? And we're going to get into what you maximize the most and the services that you bring. But we're in a very challenging time. There are two things as far as the pandemic and stuff is going on. How has that affected you and you worked around it? Number one. Number two, how can we empower communities to see the value in everything that you just talked about as far as relationship between, I say, human to human interaction? Because when we start saying doctor and patient, there's a separation there. But if we say human to human interaction, then that put us all on the same playing field, because realistically that's what it is. So how's everything changed with your practice during the pandemic, number one, and how can we empower the people to see the value in what you just said?
Well, I think the one of the main ways that the pandemic impacted my practice of medicine is that at a time when I was actually newly opening a practice, that's when most people were not going to the doctor because of COVID. So definitely impacted the way that the practice grew and how much time it took for the practice to grow in general. And also I feel like has kind of impacted my ability to go out into the community and do outreach, which is something that I really, really wanted to do. I wanted to go into the communities, let the people find me, let the people see who I am, and tell them more and do more things. But because of COVID, that has kind of hindered that a lot because people are not out. The elders are not at their community centers anymore. And so it's been harder for me to access that. That's been really tough. I think as far as empowering people, it's more so about getting the information to the people who need it the most. I think a lot of times what's happening is people have no idea that I'm even here. And in the building where I am, I'm in a building. I don't have a storefront where when you pass by, you know that there's a doctor inside. So a lot of people are like, we didn't know you were here. Oh my God, you're right here. I'm really very close to 45 and Beltway 8, where they intersect on the northwest side of Houston. Um, and I'm in a community where there's a lot of underserved people. but a lot of people have no idea that I'm here. So it's really interesting, just trying to figure out how to get the word out. And that's how you and I met, because I started reaching out to people that I felt uh align with the mission that I have to help people to be healthy. People who are personal trainers, people who actually care about the health of others, and letting them know that, hey, there's something that I have that I can offer to your clients that can help them with their overall health goals, as well as their exercise goals or other goals that they have. And so just trying to figure out how to align with people in a way and network with people in a time when people cannot really come together safely. So I think that getting the information out there, doing these Facebook lives, I'm really excited to actually be involved with this, because I'm not the most tech savvy doctor. I can sit down with you and I can face to face, like I can work it out. But when it comes time for, a lot of technology, I'm not the best at that. However, aligning myself with people who are better at it than I am, and uh, letting them show me and teach me things. So I think that this is kind of one of those times where we are connecting as people in a new way. And I think empowering the people is really about getting information out. It's about getting the information to the people who need it the most, so that people can know that these things exist. Like I said, most people in the Black community do not know about hormone balancing at all. They have no idea that a lot of the problems that they see are being caused by hormones. They have no idea at all. And so it's so interesting to see some of the results that have been happening when I get patients that actually listen to me, hear what I'm saying, and are willing to try something different. For instance, I have one patient, he's in his early 50s. He came in to establish care. He doesn't like going to doctors. He doesn't like taking pills. He's a truck driver. Okay, so in general, truck drivers they have a hard life. They spend a lot of time on the road. Um, they eat fast food a lot because they're out and about. They don't really have a lot of time to exercise. A lot of them get very overweight, and so this particular guy, he came to me and he was having some issues. He couldn't quite explain what was going on. And so we did, as part of my general labs that I do on everybody, I do a very comprehensive panel, which includes a complete blood count that checks for anemia. It includes a comprehensive metabolic panel. I'm checking your kidneys, your liver, your electrolytes, all of your proteins. I'm checking your vitamin D level, your B12 level, your thyroid studies, as well as an antibody against the thyroid. A lot of people don't know that their body is attacking their thyroid, and that's causing problems. I'm checking a cholesterol panel, a hemoglobin A1C to check for diabetes, and I'm checking your testosterone levels, your estradiol levels, which is a type of estrogen. For men, I'm checking a PSA, which is checking the prostate to make sure it's not elevated. For women, I'm checking a FSH to make sure that their hormones are not sending them into premature menopause, or to find out if they're in menopause or where they are on that spectrum. And it's this big panel of labs that I've made very affordable for people so that we can find out. And said all that to say, this man came in, had no idea he was a full blown diabetic. When I say a full blown diabetic, I'm saying in order to be considered diabetic, a hemoglobin A1C is a measure of how much sugar your body has seen in the past 3 months. In order to be considered diabetic, 6.5% or higher is the number that we look at. This man's hemoglobin A1C was 12.3 when he came in, and he had no idea that he was diabetic. His blood sugar was 329. A normal blood sugar is between 60 and 100. He had no idea. So now, mind you, this is somebody, whenever your hemoglobin A1C is over 9%, we are supposed to put you on insulin. Okay. But I knew that this man would not be able to handle that. He barely could take a pill on time. Okay. He does not like medicine. He doesn't like doctors. Um, and so I knew that that wouldn't work for him. That would just set him up for failure. And that's one of the things I think when you have a doctor that actually knows you, that's one of the benefits. When you have a doctor that knows, your personality, what will work well for you, and can sit down with you and actually explain what your options are and give you options, so that they're not just dictating to you like, you're going to take insulin, you're going to do this. So this is what I did. Something that's completely out of the box. Okay. This man, if not on insulin, should definitely have been on 2 to 3 diabetes medications, 2 to 3 at the least. I decided that I would optimize his hormones and then put him on one diabetes medication, just one. He was supposed to be on 2 or 3 and some insulin, sticking himself with needles every day. I said, okay, we're not going to do that. Optimize the hormones, one diabetes medication. That's what we did. In 6 months' time, we took that hemoglobin A1C of 12.3 down to 7.7. So we are closer to out of diabetes range than we are to where we were at first. And that's with him not taking the medicine all the way he's supposed to. Remember, he doesn't like taking pills.
Right.
So later on, he was like, actually, I only was taking it once a day, and this kind of thing, and still kind of eating bad a little bit. But even with him still eating burgers sometimes, and with him not taking the medicine completely the way that I prescribed it, but he did the best that he could, optimizing the hormones, we almost reversed it. With that one diabetes medication, we should have expected to see that hemoglobin A1C number come down about 1 to 2%. This is a proven fact in the literature. If you put a person on metformin alone, you should see 1 to 2% decrease. He decreased by 4 to 5% from 12.3 to 7.7. That was way more than expected. And that just goes to show you how important hormone balance is. You can be fighting an uphill battle if you don't fix the root cause of the problem. And so that's what is so important. Getting the information out there so that people can understand that it's not just about all of these pills that we're giving people as band-aids over a gaping wound. We have to sew the wound up. We have to fix it first, and then people can get better. So that's what I'm trying to do.
Woo! Hold on. I mean, it's kind of like, and people may have heard this before. You know how when you're walking on a treadmill and then you get off the treadmill and it feel like you're still walking.
Yes.
That
That
that's
happens
what's
to me.
happening right now. But I'm trying to process all that great information that you gave me. And Jason mentioned that he's a nurse, and he says, he had that same experience in the ER last week, where the glucose was greater than 700, the maximum of our
Ooh.
machine. Patient has no idea, thought he might have COVID because he was tired and no appetite, and his sugar levels were up. So I love what you're doing because, and I know there are many other doctors who are doing the same thing that you're doing. And that's why this is so important that people hear from you of what you're doing. And so it will hopefully build confidence in finding someone who has the right bedside manner, just
Yes.
like
It's
you.
very important.
So I mean, it's like you're setting a standard in reference to how doctors are supposed to be, which is again human to human interaction. You're not doing it looking at them as just a patient. You're
No.
looking at them as if you were looking at them in the mirror as a human being, because that's who we all are. We all are human beings, and that's why I say it's so important for us to see the value in uh, being humans first before we
Yes.
are workers.
Yes.
If we're workers first, then humans later, we're out of order. So you're doing a fantastic job in breaking down how treatment is designed to be done, from human to human interaction. So I have a question for you,
Yes.
because I had a client who mentioned something about panels, and people will go to and they'll get their general assessment, their yearly physical or whatever, and they run blood work and they give them certain numbers and everything of their hormone levels. But I always encourage them to an extent to go to an endocrinologist because they run different panels of blood work, for them. So could you share with our listeners how important that is as far as their hormone levels is concerned? Because again, here it is, they go and they find out from endocrinologists what they didn't get from a general practitioner of the panels that they ran on them, and they could give them more specific information. Then they can say, okay, I need to find Dr. Irving now. You see what I'm
Right.
saying? So how can you explain to our listeners the importance of the frequency of getting blood work done from maybe an endocrinologist or someone along that line um, after they have had their annual physical?
Well, I guess it all depends on each person, because I don't think that everybody needs to go to an endocrinologist, but I think that some people might need to go to an endocrinologist. So what the problem is that a lot of times they have, there are a lot of doctors that are, they're surface scratchers. They don't dig, they kind of just, do the basics, the bare minimum, and then the person is still feeling bad. And I think that that's kind of what is going wrong. Because the type of things that I do as far as the hormone balancing, this is not something that they teach you in medical school. It's not something that you learn in residency. I had to go to additional training to learn how to do this. So the average doctor, including an endocrinologist, would possibly look at the hormone levels that I look at and see them completely different, and would tell the person that the hormone levels were normal, even though the person has all of the symptoms of hormone imbalance. And so the problem is that we're not treating numbers, we're treating people. Well, I'm treating people and not treating numbers. Only numbers. It's more to it than numbers. It's about the symptoms. It's about what the person is experiencing. But I do feel that when something like this happens, if you have a person whose diabetes is hard to control, or a person who has insulin resistance and they are not really understanding how to, or they don't have a doctor that can sit down with them and spend time with them and teach them or work with them on how to undo that, then they may need to go to an endocrinologist. But the main thing I think is being able to find a doctor who cares, because you can go to an endocrinologist that can treat you, treat you the same way, just the quick fix, the quick doctor fix. And so, um, you are still right where you started off. I've had patients to come to me that have gone to literally every type of specialist that exists. I have one patient that has gone to an endocrinologist. He has gone to a neurologist. He has gone to a cardiologist and had stress tests. He's gone to a GI doctor. This is a 30 something year old man that has gone to doctor after doctor after doctor, and nobody could figure out what was wrong with him. And so coming to me, we have been just tearing down all of those bricks, just taking them down, working on his health. And now we're getting somewhere. So I think it really just takes having the right doctor to do it. And that's the good thing about, me. Yes, I am located in Houston, but I am licensed in the state of Texas and in the state of Louisiana. So I still see also patients on telemedicine as well. So they're like the patients that are up in Mesquite. I can see patients in Mesquite because I'm licensed in the state of Texas. And if somebody just decides that they want to drive down to Houston, I will be happy to see them as well. I have had patients, like I said, I did residency in Louisiana. I have actually had one of my patients from Louisiana to drive down over 5.5 hours to come and see me, because she the care that she received from me, she could not find other places. And so that was very important, and that was very humbling, that somebody would do that, especially in the middle of a pandemic. But she wanted to come and see me, so I really appreciated that. And I just think that a lot of people are just, they're they're going and they're not getting what they need, and then they just kind of give up and they don't keep trying, or they don't keep looking. I feel like that kind of crosses over into the spiritual walk as well. A lot of people, they're looking for God, they're looking for spiritual guidance, and then if they run into somebody who may not be the right spiritual guide, or may be somebody who's not actually following God, and are leading people astray, then they're like, oh, all people of God are this way, or all men of God are this way, instead of them continuing to seek God, just continuing to find God. They just kind of be like, oh, this is not for me. And I think that that's what happens a lot of times in the medical world as well. They have one bad experience, and then they're like, all doctors are this way. I can't tell you how many times I've had the all doctors talk, even in my presence, or these doctors, like my patient that I was telling you about that was diabetic. It was kind of funny because he went on a rant about these doctors telling you have to eat right, and these doctors, and I'm like, I'm your doctor. I'm your so it's interesting, but it takes a while, and it takes a lot of patience to break down those barriers, and to not get frustrated with people who really, really, they're crying out for help. They just don't know how to say, I need help. They don't know how to, especially when it deals with men, and especially I would say when it deals with our black men. It's hard for them to humble themselves and to say, hey, I actually have an issue. I actually am having a problem. And I have my little questionnaire here to kind of go over some of the symptoms. Whenever you're ready, we have a little questionnaire so that people can see some of the symptoms. But a lot of things that a lot of men don't like to talk about, especially sexual health, they're embarrassed. They feel that they don't want to tell people that they may be having some problems with erectile dysfunction or with sexual dysfunction or low libido. And then these things cause problems in their lives in other ways. Their wives are like, what did I do? Why do you not want me? And they're like, it's not that. And the wife is like, well, what is it? And, it's all this emotion. And they're like, I can't deal with this. But they don't want to tell their wife, actually, I have an issue. And so that's what the doctors that actually listen like me are for, so that you can actually be real. I have some patients that are so real sometimes that it's just like, whoo, it'll blow you back. But but I love it though. So
Awesome. That is awesome. Oh man, great, great information. I'm excited about that. Shoot, I listen, I am, you have people who are great storytellers, but how often do you hear about people who are great story listeners?
yes.
So that's me. I am a professional story listener, and I like to let it marinate, and process, because I mean you're doing a phenomenal job empowering me as well as our listeners. So I think it's great that I was going to ask you about telemedicine, and that you
Hmm.
are doing that, which is fantastic. And hopefully Jason is still on and can reach out to you where he will be able to help those individuals who because he said I wish you was wish you was in Mesquite. So that'd be great if you guys can connect and everything.
Yes.
Tell us a little
Hmm.
bit about the hormone process and how it goes from the interview, so to speak, and the process and just the the whole process and procedure before they come back and do it all over again. Can you share that with us?
Oh, okay. So let's go through how I would evaluate you for a hormonal imbalance. So, first thing that we do is we have a consult that can be by telemedicine or it could be in the office. Um, and we will then kind of go through the paperwork. I will send the paperwork either to you on email, or you can fill it out in the office if you don't want to do it on email or scan it back or whatever. And basically, I there's questionnaires that ask you about a lot of the symptoms and what you're experiencing, and then we can kind of talk about it. So that's one of the things. So here, we'll talk about for men specifically. Now, uh a lot of these symptoms cross over for women. So I will kind of point out the differences between the men and the women. I'll go through first the men, and then I'll add on after the fact the symptoms for women, because I want the men to know what the symptoms are also for women, because I'm sure some of them are married, some of them have significant others, and they may be seeing these things and not knowing what's going on. Especially if they might be younger, they might think, oh, well, we're too young to have that issue. And that's not always the case. So, as part of this evaluation, one of the things I do, we do this questionnaire together. This is one of the questionnaires. And so here, and it has a scale of never, mild, moderate, severe, very severe. So for those of you who are catching this on the replay, um get your pen and paper out, and you can score it for yourself. Okay, so 0 is never, 1 is mild, 2 is moderate, 3 is severe, 4 is very severe. Okay, so these are the male symptoms. Sweating, that includes night sweats or excessive sweating. So I have one patient, he told me that sometimes he sweats so much he has to literally pour sweat out of his boot when he's working in the summertime. I know it's crazy, but it hormones. I know it's serious though. Um, then you have sleep problems, which is difficulty falling asleep, sleeping through the night, or waking up too early. A lot of people don't know that hormones affect your sleep. When your hormones are low, you may just feel like you only can sleep 2 or 3 hours a night and don't know why. It can be hormones. Increased need for sleep or falls asleep easily after a meal. So you know how back in the day you could eat and still go. Now you eat and you fall asleep very easily, or you fall asleep really early. Don't really have a lot of energy. So depressive mood. That's the next one. Feeling down, feeling sad, or having a lack of drive. So when you just don't feel very motivated to do anything, or just don't really have any interest in anything, just you know. And I know with COVID that really has exacerbated that so much. What about irritability? I've had a lot of wives say, "Yes, that's my husband. He's the grumpy gills." So mood swings, feeling aggressive or angering easily. Anxiety. So that's feeling inner restlessness, or feeling panicky, feeling nervous, or like an inner tension, like you just can't really rest or calm down. You just always feel like you're waiting on the shoe to drop or waiting on something to happen. Uh, Physical exhaustion. So this is something that I really feel impacts trainers like how you are, because this is one of the things that is a hindrance to people being able to get their fitness goals. They have the desire mentally, but they're tired. They actually have a physical exhaustion that they just don't know how to overcome. No matter what they do, no matter how they do it, they just feel tired. So it's a general decrease in muscle strength or endurance, a decrease in work performance. So if you notice that on your job, you're not able to do your job, you're too fatigued all the time. Lack of energy, stamina, or motivation. So that's a person who back in the day, they could work out for long periods of time. They could lift weights, and then when they lift weights, they just feel how you guys are. And now they lift weights, and they're like, okay, that's enough of that. After about 5 minutes, they just want to go sit down. They're too, or they just never start. They're too tired.
Right.
Um, the next one is sexual problems. That would be a change in sexual desire or in sexual performance. The next one, bladder problems, difficulty in urinating, increased need to urinate. The next one, erectile changes. So that's less strong erections or loss of morning erections. A lot of men don't realize, they just think, especially women, just think that that's something that, you know, men, a morning erection is normal male anatomy. And when that is not happening anymore, that is a sign to you that something is wrong. Okay. So that should happen. If that is not happening spontaneously without you doing anything, that's a problem. Okay. The next one is joint and muscular symptoms. So that would be joint pain or swelling, muscle weakness, poor recovery after exercise. So I don't know about you, but there are some people who, once they exercise and they get a real good workout, it'll take them about a week to recover. They are still hurting, they are still sore, they just cannot recover from it. That is hormones that does that. When your hormones are low, you don't recover as well. Difficulties with memory. A lot of people, how when you get older, you be like, "What's that boy name over there?" You feeling old, and feeling like, I don't, boy, come here. What's your name? I have a cousin. She can't even remember her own children's name. She calls each one name and the other one's name, and she's like, "You boy, I'm talking to you." That kind of thing. Um,
Are they gonna?
pro-
Hey, are they gonna sound like that when they start forgetting? Yeah.
yeah, that's how they do it. They can't remember, things, just forgetting things. And a lot of times people feel distressed by that. They like, I can't remember anything. I know for me, before I started optimizing my hormones, how that manifested in me was I was having trouble remembering numbers, or like short-term memory. Like, say for instance, if I'm in your patient chart and I'm trying to build you a chart in the lab, and I'm trying to bring your phone number over from there, from just one window to the other one. And I'm looking at the number, I'm like 713-659-9309. That's my office number. So 713-659-9309. And then I get to the other side, I'm like 7136. What? Go back 599309. I go back 59. Wait a minute. Go back. And I just kept going back and forth, not understanding that trouble with the memory and the concentration was actually because my hormones were out of balance. I don't have that problem anymore. Um, and then, so problems with thinking, concentrating, or reasoning, difficulty learning new things, trouble thinking of the right word to describe persons, places, or things when speaking, increase in the frequency or intensity of headaches or migraines. So if you notice that you are having more headaches, more migraines as you get older, that could be because of the hormone decline. A rapid hair loss or thinning, feeling cold all the time or having cold hands or feet, weight gain, especially increased belly fat. So you know how when you get a little bit older and men get the belly, around the middle and they feel like that belly just will not go away. They can lose weight everywhere else, but that belly will not go away. That is the hormones doing that. Um, Difficulty losing weight despite diet and exercise. Like if you just can't get it off no matter what you try, that can be hormones that are blocking it. And then lastly, it deals with the infrequent or absent ejaculation. So that is also something that affects men. Now a lot of it, like the general symptoms, things that are, fatigue, sleep problems, anxiety, irritability, exhaustion, bladder problems, all of the thinking, concentration, that's for everybody. But the difference between women and men, the just a few symptoms that are different, is that women have the hot flashes. I'm sure some of the men know when their wife get the fan in at home and they're like, oh my God, turn the AC up, and the husband is freezing. He has on flannel and the wife has on shorts. And they're trying to figure out what's going on. And then the other thing is some women are having pain with intimacy, or feeling dryness with intimacy. Um so and then the weight gain, the dry or the wrinkled skin, those are things that kind of typically affect women, that don't affect men. But all of the rest of it, the sweating, the sleep problems, depressive mood, irritability, anxiety, all of that, that is for men and for women. The things that are specific to the men deal with more of the sexual health of the man that I said, and the things that deal with women deal more with the sexual health of the woman and the hot flashes. So those are kind of the main differences. So we go through all of this. We order labs. We review these labs together. Sometimes I'll order the labs before you come so that we can look at it together and go through it. We come up with a plan of action, and then we plan to optimize the hormones. Once those labs come back, you can get those hormones optimized the same day, the next day. Once those lab results are back, you are ready. And it is based on, it's all personalized. So what one man gets will be different from what another man gets. So it's based on your weight, your age, your kidney function, your hormone levels at the beginning, where you started, and all of these things go into a complicated calculation that helps us to decide how much testosterone that you will need. Now, the women, we are also deficient in testosterone as well. That's the main deficiency that women are seeing. So a lot of people are really surprised. They think, oh, it'll be estrogen or it'll be, but testosterone is the main thing that women are being deficient in. And but the difference is the levels where women need to be versus the levels where men need to be. The levels where women are, the men are like 9 to 10 times higher in, where you should be. So it's a different dosing, it's a different type of pellet. Everything is a little bit different for the women. It's a little bit simpler, but for men it's a little bit more, it's a higher dosage. And so after that, we do a procedure. So once we go through everything, we plan for the procedure. The procedure is a short in the clinic procedure. You don't have to go to sleep for it. You're awake for the whole thing. We're talking through it. I've even had one of my male patients, he slept through the whole thing, snoring and all. And we had to wake him up, tap him at the end. So it's really straightforward. I numb the area up, and we place some hormone pellets that are made of bioidentical hormone, which is hormone that is exactly the same as your chemical structure of what your body naturally makes. So your body thinks that it made it. It's like, yay, I don't have to work so hard. And so what over time, for the men it lasts for 4 to 5 months, for the women it lasts for 3 to 4 months. Over time, your body will slowly dissolve those pellets, and you don't have to take anything out. You don't have to go and retrieve anything. Your body will deal with it. And then after 4 to 5 months, then you have it replaced the next month, the next time. And so it has been a real game changer for my patients. For people, like I said about the guy with the diabetes, almost reversed his diabetes, and we're just getting started. That was after his first round of pellets. So you can imagine that as we continue working on him, he's just going to continue to get better and better. So,
That's awesome. That's awesome. Are you able to share a range as far as cost is concerned?
oh, sure,
Okay.
sure. Okay. So at my clinic, the consult is 150. The lab work is $200. And for men, the procedure is $800. For women, the procedure is $400. So the difference is, in order for a man to actually have hormones optimized at a somewhat steady level without having something that's a slow release, like what I'm talking about, he would technically have to get about 2 testosterone shots per week. The testosterone shots, the ones that go in the arm, they are not bioidentical hormone. They are synthetic hormone. They have a lot more side effects that the bioidentical hormones don't have. And it's much more painful. And it's a cost associated with that. So imagine you're paying 50, $60, $100 per shot twice a week. That's 52 shots a year. And that's also a roller coaster ride with your hormones because it peaks out in about 2 days, and after 2 days it's back where it started. And then you do it again. Whereas with the hormones that I'm doing, we put them in, they slowly rise, and then they stay there. They just stay there for months at a time. So your hormones are just leveled off. And if you come in like you're supposed to, as it starts to decline, we put the next set of pellets, and you never feel that drop. You just continue to keep everything steady. And that's the ideal way to do it. Yeah.
I think that's important, that the people, many, especially in our community, and they look at the cost and everything and be like, ooh, child, that's too much for me. But it's all about your health. It's how much do you value your health? And we all
Yes.
make investments in our health every day, from the food that we buy, the things that we drink and we put into our bodies,
Yes.
investing into our health every day. So there's no reason why we can't put the money to the side, because we make time for the things that we value the most. You
Definitely.
know what I'm saying? So
Definitely.
I think it,
Definitely.
for these individuals to see the value in their own health, it's all
Yes.
worth it. A lot of times I tell my clients, I say, God forbid something was to happen to you and you was diagnosed with a debilitating disease. How much time and money would you put on the side then for you to do what you need to do to get the proper treatment, so
Exactly.
you would get, you would have better results and that disease would leave from you? Don't wait till you put yourself in that type of position to where you're working out of fear. Be
Yes.
proactive about
Yes.
it. And so it's good that you sharing that information. And like you broke it down, look, there's a difference between what the average doctor will give you. It doesn't have the same substance and impact as it does of what you do, which is more
Yes.
specific. I guess we can say, when you go to the average doctor, general practitioner, who gives the shot, they're treating everyone with the same thing. Am I right about it?
Right.
So
That's
what
exactly
you
right.
do is very specific to the needs of the individual, which is a
Yes.
completely different ball game. Is that correct?
That's correct.
So I
That's
mean,
correct.
if we want that attention, since we all say that we special and we want special attention, well, if your health is worth the cost, then there's no reason in the world why we should not see the value in getting something that is specifically for us and not for what everybody in the city of Houston is taking.
Definitely. And you know what else too? You have to think about it when you kind of break down the cost. If you were having to go to the doctor a bunch of times a month, you're having to do a lot of things to keep up with your health, or you are having all of these issues come up. What is that worth to you? I have had patients. I have one patient in particular that I'm thinking about. She's over 60, and she really was struggling in general. She felt terrible. She had no energy, and she has a husband that loves her so much. Still, there are some couples that even they don't age doesn't matter. They still love each other. They're still into each other. They still want to be intimate. I don't know why people think that when people get older that just stops. Um, but she wanted to do these things, but it was so painful. It was so, it was just, it was such a struggle for her, and she felt so bad, and she didn't have any energy. She didn't want to go anywhere. She didn't want to do anything. Her vibrance was gone. And now when she came to me, she said, Dr. Irving, this is my last stop. Like, basically, she said, I've tried everything. I've done everything. I don't know what else to do. I've never tried this, so I'm willing to try it. And when I tell you, libido went from, she said, from negative 100 to a trillion. If you go on my Instagram page, I actually have her actual testimonial up there, a part of her actual testimonial. She said that her husband told her that he has not been this happy in over 20 years, like with their intimate life. And then the husband himself came to me and he said, "Can you turn it down a little bit?" because she was like, it went from him being the one that was more aggressive to her being the one that was more aggressive. And he was like, "Woo, I'm trying to keep up with her." And so that made a big difference. Another patient that I had, he's in his mid 30s. Okay. Like I said, it has nothing to do with age. He's in his mid 30s. And I was telling him, I said, I can make you feel like you're in your 20s again, make you feel like you're 25 again. And you know what he told me? He said, "My wife already thinks I'm 25." I said, "Oh, really? Okay. Well, when your wife comes in with you, I'm gonna ask her myself." you know. And so he and his wife came in, and I asked his wife, did she still think he was 25? She said, "Oh no, oh no, 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 no." And so here he is. He's a little embarrassed, and I'm joking with him, like I said, just to be able to have that relationship with your patients where you can just be lighthearted and have fun. And so later on, it came time she was ready to do hers. So she was so excited about what happened to him. She was ready to do her pellets and everything, ready to do all of the hormone optimization. And so now we're all on the phone. We're on a three-way call and we're discussing everything. And after we got through dealing with her and going through all of her lab results and everything, now I asked the husband, the same husband, I asked him, I said, "How's your energy level now? How's everything now?" And he said, "Ask my wife." That's how he did it. I said, "Okay," trying to be funny because I kind of called him out the first time. So I said, "Okay, let me ask her." So I asked her, "How's his energy level?" She said, "Good, extra good." That was her answer. So we went from "oh no, no, no" to extra good. Um, and people think that this is not important, but these things are life impacting because these are the type of things that destroy marriages. These are the type of things that create problems that destroy families. A lot of people don't realize the irritability, the depression, the lack of motivation, and the other spouse is feeling like that they're not into them or they don't care about them, and then this creates a snowball effect where things are happening in people's marriages. And for the single people, it has really, really been game changing just for energy level in general. It's not all about libido. I tell everybody that to me, the libido part and the weight loss part is the icing on the cake. Now, if you don't need all of that, that's fine. You don't use it for that. But the weight loss part, I also like to tell people, is not this is not a weight loss drug. So you will not expect to take the hormones and then you're just going to lose weight. That's not how it works. When you take the hormones then remove the barrier to you losing weight. The reason why you could not lose weight is because the hormones were out of balance. When you balance the hormones, if you start doing what you're supposed to do, you start exercising, you start eating right, cutting out some of those carbs, the weight falls off. I have a patient over 50, and she works a job that is very strenuous and very physical. And she was just not losing weight. All she did was change what she was eating after she got her hormones done, and that weight just fell off. So, but you have to do the part. You have to do your part, and it will continue to get better and better. And so that's the thing that I want people to understand. A lot of people do focus on the money aspect, but after they get it done, they feel that it is so worth it. They ask me, "Where has this been all my life?" And the sad part about it is that there are other communities. This type of hormone therapy that I'm talking about to you has been around since the 1930s. When was the first time that you heard about it? When I told you, right?
No, I,
So
I I knew about it.
you knew about the pellet therapy as well?
Yes, I have a client who does that.
Okay. Well, so you had heard about it from your client. But a lot of people, they have never heard of this. They have never heard of this. And not only that, I know that the prices may seem expensive, but the truth of the matter is that I charge way less than other doctors who do the same thing that I do. And the reason why I do that is because I want people to be able to access it. I don't want it to just be so cost prohibitive that people just don't even want to try, you know. And so that's one of the things that I try to do is to make it to where it's affordable as I possibly could. given the materials and everything that goes into it and all of the stuff that I have to pay for on the back end to provide that service for people. But I still want to make sure that people can access it. And like you said, a lot of people don't think about that they can save up toward things. Just like you have other goals, you can put the money aside. Some of my patients even pay ahead. Like they may pay $200 here, $300 there, 150 here, another 150 next month or whatever until they pay it up and then they come and get it done. And so that's how they do it. They set that money aside or they'll pay the money ahead to make sure that they don't spend it. And then it'll be reserved for them. So when they're ready to come and once it's all paid up, then they just come and get it done. So there are so many ways around this. Um and you don't have to feel like that the money is the only thing to prohibit. So,
Yeah, I like that. I love how you're flexible in helping them with payment plans to be
yes.
able to do it and not having to pay it all up front. That makes a world of a difference,
Right.
with people, who know that they need it and will see the value in getting it. So I'm glad that you mentioned that. So that's pretty awesome, man. Listen, there are like, about at least 500 more questions that I wanted to ask you, but we're gonna have to say that for next time.
Yes.
And
Maybe people might have more questions, and so our next one can be even more lively. I would love if people wanted to submit questions either openly or anonymously, especially if it's something that's a little sensitive or touchy. And maybe we can kind of dive into some of those things. People can really talk about the real. One thing I know that you were telling me about on your show is that you deal with real issues, real subjects for real men. And
absolutely.
I definitely would love for men to really be real with me and ask me questions and ask questions about things that might be going on that they've noticed about themselves or didn't realize were a part of their hormonal imbalance and that they didn't even know that they had it and didn't know that it could ever be fixed. A lot of people just say, "Oh, I'm just getting old. This is normal part of getting old." And they just kind of accept it. And they don't realize that you can actually come out of that. You can actually be healed from that. You can actually live your best life. And the whole purpose of me doing all of this is because what I'm trying to do is restore lives. It's not about the libido part, it's not about the weight loss part. I am trying to restore lives because what can you do with all of that extra energy? What can you do? What can you accomplish in your life, your goals, things that you may have set aside because you just didn't have the motivation or the energy to get it done anymore? What could you do with that energy? What could you do if you don't have to worry about diabetes 20 years from now and have to have a leg amputation? What could you do? What mountain could you be climbing? What trip could you be on? What beach could you be on? Rather than what couch could you be on because you don't have any energy. So that's what I'm trying to do is to help people to realize, like you said, proactive instead of reactive. Let's do something before it all breaks apart. Don't wait till the last minute and wait till everything falls all apart. Let's fix it. Let's get ahead of it so that we can prevent it from falling apart. If it's already falling apart, let's put it back together and keep it that way.
Absolutely. Absolutely. Well, thank you so much. I appreciate that. And we're going to do this again because it's all about
Yes.
building relationships. And I'm definitely going to be able, put this on the YouTube channel and share this as many times as I can because this information is so helpful for me. And I even got this on we have a private group, a man to man, let's talk private group. So
Yes.
this was shared to that group as well. So hopefully the men there will be able to check that out. But we definitely going to connect and do more things together because we have so much in common.
Yes.
And so before we leave, could you just share, some words of empowerment to the listeners about their health and just taking care of themselves?
Yes. So what I would tell you is to value your life and your livelihood and to understand that procrastination is the arrogant thought that you have all this time to accomplish things that you should be doing right now. So, if I were you, I would take all of what God has given me, all of the resources and whatever I have to do my part to empower myself to be a agent for change for my own health and to realize that God is there to give us wisdom. He said to be wise as a serpent and harmless as a dove. So you have to be wise, even even in seeking God, you don't want to just not do your part and wait for God to fix it all up for you and want him to reverse it when you didn't want to do your part. God looks for us to do our part. He looks for us to strive to be the best that we can, to take care of our bodies as temples of God, so that we can live the life that God has for us in abundance. And so that's what I would say. It's all about living the fullest version of yourself and not settling for less. And that's what having optimal health can do for you.
Absolutely. Thank you so much. I appreciate that. I really do. What we'll do right now, man, that's great, man. I'm excited, girl. We did it. Yeah, I thought you was gonna give me some more of the, you know what I'm saying? But that's for all screen. That's for all screen. We just sit. We were crazy.
Yeah, we're
But
having so much fun. I would love to do one of these calls or something with real men live, like where they can kind of give us some live feedback, and we can make it a more lively discussion as well. I
I
think that
got
would
you
be so
covered.
fun. I would love to hear what they have to say.
Woo! I got you
Especially after
covered.
hearing all of this. I would love
Yeah,
to hear, guys. I want to
yeah,
hear what y'all have to say. I want to hear about some of your struggles and some of the things that you may not have mentioned to anybody else, and or after hearing some of these symptoms, knowing that, hey, that's me. I didn't know that that's what that was. Let's talk about it. Let's deal with it. Let's fix it.
yes,
So I'm excited.
absolutely, absolutely. So listen, don't go anywhere. I'm gonna put you back in the weight room so I come in and I'll chat with you a little bit. I'm gonna close out and then
Okay.
we'll take it from there. Okay.
Okay.
So, ladies and gentlemen, give it up for Miss Dr. Lataisha Irving.
Yes.
Y'all give it up. Give it
Did we
up.
tell them where to find me? I
Yeah,
forgot
please
to tell them.
give them the handles, please.
Yes. Oh, okay. Before we go, the my office is called Exceptional Care Elite. The website is exceptionalcareelite.com. So that is EXCEPTIONAL care CARE elite.com. The phone number to the office 713-659-9309. You can find me also on Facebook under Exceptional Care Elite PLLC for my business page, and also on Instagram under X Care Elite, and Twitter under X Care Elite, EX Care Elite. All right. Come
Fantastic.
find me.
Yeah, yeah, yeah. Oh, I'm sure you're gonna be getting some calls now, girl. Yeah. Hey, even got it on the business page, the Houston Black business page, and the other business page as well. So I shared it all on there as well. So hopefully these individuals will check it out. But just
Yes.
I'm gonna put you in the waiting room and I'm gonna come chat
Okay.
with you right when we close out. Thank you so much for joining us.
Thank you.
All
I
righty.
enjoyed it.
Oh my gosh, that was fantastic. Oh, that was fantastic. Guys, listen, all I got to tell you is own your body. Take care of your body. Nobody knows your body like you do. All right. So, uh, Dr. Latasha Irving said enough. And if you have any questions, please, by all means, contact me and let me know. I'll reach out to Dr. Irving, whichever one works best for you. Please do that. And don't take your health for granted because your health is your wealth. So please do that. So I encourage you to stay focused, stay in your lane so you can stay the course and just know in order for us to be great, we must communicate because God has a purpose for you just like he does for me, which means there is no need for us to compete. God has given us all enough air to breathe, which means there's enough blessings to receive. And I need you to ask yourself this question in all the things that we do, if the answer to your why does not include God, then why are you doing it? Please keep those things in mind. Remember to take care of your health. Know that if your hormones are out of whack, then you can call Dr. Latasha Irving. Thank you so much for joining the Facebook Man to Man Let's Talk show. And if you have a business or an organization that are doing great things in the community, please let me know. I want everybody else to know what you're doing. And so those individuals who are looking for you can find you. Okay. So please let me know that. And then we'll just take it from there. But you guys have yourself a great evening. And if it's the Lord's will, we'll do this again. Please follow us on the Man to Man Let's Talk YouTube channel, as well as Eugene Johnson Jr. on Facebook and my training page, Eugene Johnson Jr. In Home Personal Training. So please follow me there and I help you with any health and wellness goals that you may have. I love you guys. Take care. Men, man to man. Let's talk.